In the interest of time, we will go ahead and get started. We might have a couple other people joining us, but welcome everyone to our interactive motivational interviewing workshop number 2. This is brought to you by the Patient Navigator Community Health Worker and Promotores de Salud Alliance with funding from the Colorado Cancer Coalition. We're so excited to have a few new people, and I know many of you are returning from last time, so thank you for joining us. I'm Erin, and I'm your tech support, so I can help you troubleshoot any audio issues and that kind of thing. I know many of you do not have a webcam, but if you do, please turn it on because it helps make a better experience for everyone. We love to see your faces. And yeah, we will go ahead and get started. I'll introduce Bonita Bird, who is our motivational interviewing instructor for this series, and she will get going on the second round of content. Is there anything else I forgot to mention to get us started? I'll unmute you. There you go, maybe.
There. Good morning, everyone. I'm Bonita Bird, and I'm a public health nurse that I'm retired currently, but my last job, we worked with women who used alcohol and had unprotected sex to try to prevent fetal alcohol syndrome. And we used motivational interviewing as our intervention technique. At the end of session 1, I asked you to choose one of the skills that we covered and practice that for the couple weeks. And I'm wondering if how that went for people that were here last week, or 2 weeks ago, I guess, 3 weeks ago. Did anybody identify a skill to focus on? Just unmute and talk to me.
So Carolina says that she realized how much lecturing she did when she typically talked to people.
Okay. So did you try more listening then?
And I can unmute you too if you want to talk, Carolina.
Hi, can you hear me? I think last time there was issues with that.
Yes, no, we can hear you loud and clear.
Cool. No, I just thought like I talked to a lot of people and I'm like, okay, this is what you're supposed to do. And I'm just becoming more aware of like how that's not okay. And like maybe trying to like say what they are doing right, or like be glad that they are trying to do something. And maybe like, I think you mentioned last time how if they weren't going to listen in the first place, maybe don't like waste your breath.
To get their permission to give them information.
Mm-hmm.
Okay. Anybody else? Usually becoming self-aware is the first step. What am I doing now? What could I do different? So just a quick review. Last time we talked about the spirit of MI, the collaboration, evocation, compassion, and acceptance. We talked about basic skills of engaging and focusing and getting started with the open-ended questions, the affirmations, the reflections, and summaries. We covered providing information and advice with permission, with an elicit, provide, elicit pattern. And then we did some application. So today I'm going to share my slides here, and we'll get started with the next section. All right. So this is session 2, and we have a total of 3 sessions. See if I can get my slide to move. Okay. So today I'm going to start with the principles of MI. We talked about the spirit last time. Today I'm going to talk about the principles. And the first principle is resist. And what we're resisting is our writing reflex. The reflex that we have that when someone doesn't want to go someplace, we tend to push them or pull them to go in the direction we want them to go. The other thing that we're resisting is being the expert on our topic and thinking we know what is best. Those are the things that we need to avoid. And what we want to do is roll with their existence. We don't want to have an opinion one way or the other, or to push our opinion one way or the other in their decision making. The second rule is to understand and to really listen with understanding of where they're coming from and what's important to them. And with our understanding, then we can develop discrepancy in what they're doing and where they want to go and help them make a clearer choice. The fourth rule is to listen. And we're listening to develop an understanding for them, but also so we can express empathy and understand where they are, but we want to express that understanding to them. And the fourth rule is to empower, and that's to support their self-efficacy. And self-efficacy is just a term that we use to explain that they have a choice, they know really what's best for themselves, and that they have the power, and we're just there to offer support. They can make the choice that is best for them. I might say that's the hardest to do with your own children. We reviewed the skills, the engaging, focusing. That's what you do when you first meet with your client. For those that weren't here last time, provide information with elicit, provide, elicit. You elicit what they know. You provide them with new information with permission, and then you elicit their understanding. You ask how they understand that information. And then when you're developing the relationship, you use ORS, which is the open-ended questions, the affirmations, the reflections, and summaries. Today we're going to be talking about ambivalence, and that's when you feel one way about things and you also feel another way about things. And we're going to try to develop discrepancy between those two choices that people have. And we'll also work on recognizing change talk versus the sustained talk. The next three are what we're going to do the third session. So ambivalence is a normal part of change. If you think about something that you want to change or you've thought about changing, a lot of times we feel two ways about making that. A lot of times it's easier to continue on the same path and not look fully at the other choices that we have. So when we're talking about ambivalence, we'll hear people talking and they have what we call sustained talk. That means that I want to stay the same. And they'll also have change talk. That means if I make a change, life will be different. So there's two sides of ambivalence, the staying the same, and changing. And when we develop a reflection, when we hear that, it's important to not be biased about which is the better side. And if we use the word "and" to reflect that, you want to keep your current schedule and you want to start exercising. So those kind of things. You have a time crunch and you need to get a mammogram, that kind of thing. It's reflecting two sides of the same issue. If you use "but" instead of "and," it devaluates one of the sides, whichever one you do first. If you say you want to get a mammogram, but you don't have enough time, it gives more weight to the not having enough time. If you say you don't have enough time, but you need a mammogram, that gives more weight to the not having time. So the word "and" keeps it neutral. So we're going to use today a tool called the decisional balance. And it's a way of helping people do a self-evaluation. And it's got 4 quadrants. The upper quadrant is the current behavior, the sustain, the positive of what you're doing now. And the right upper quadrant is the not so good things about what you're doing now. And then the bottom 2 quadrants are if you should change, what would be good about changing what you're doing. And usually when you do this, you have a focused behavior. And then you want the negative things about making a change. So we're going to practice that. And what I want you to practice, Erin, I think we're ready for your slide. I need to stop my video, right? There.
Got it. Do people see that? This is everybody exercise. Yeah.
If everybody could unmute, and what we're going to look at is getting a mammogram. And I want us to come up with a list of the pros, the positive things about not getting a mammogram, and then we'll do the negative things of not getting a mammogram. Then we'll switch to the bottom 2 quadrants. So Erin's going to type it in for us. So if we could just, everybody take a turn and give me a positive. We need 5 or 6 things in there if we can.
So would this look like possibly not wasting time?
Right. Right. So not getting a mammogram is you wouldn't be wasting time.
Yeah, not necessarily, but yeah, I mean from a patient standpoint.
What about participation in your health care?
Would be not getting, I think that's, that would be,
No,
that would be,
I said having more participation in your health care.
would be pro for not getting a mammogram?
No, a pro for getting one.
Okay, we're not there yet. Let's do the
Oh, okay, I'm sorry.
pros for not getting a mammogram.
I was going to say if you don't have insurance, then it could save you money by not getting a mammogram.
So saves money.
Not having the discomfort of the actual test being performed.
Right.
Not like having to deal with if your diagnosis, like not having to know what your diagnosis is.
Okay.
I think a lot of people are scared.
Mm-hmm.
Or just like not feeling that you need it.
Right. Not needed. Yeah.
Someone might say less radiation. They want more radiation.
What about if thinking if you get a negative diagnosis, there's nothing you can do about it?
So it's like a moot
Kind of like
point.
what you don't know won't hurt you.
Yeah, or, you know, if you don't have insurance and you get a negative diagnosis and you feel like, well, if I do, I can't afford to do anything about it. So, yeah, not knowing might be better.
Right. Not knowing or can't do anything anyway.
Right.
Okay. Okay, let's move over to the negative things about the cons of not getting a mammogram. What are the negative things about it?
Late stage diagnosis or getting breast cancer.
Okay.
Not having power or control of your health care.
Right, that's where that goes. Not having control.
It could probably be more expensive over time if you didn't catch it early.
Right. Well, more expensive over time.
Not setting a good example for your peers, your family.
Okay. Anything else?
I would think there would be some guilt if you didn't get it and then you found something out and you would beat yourself up for not doing it sooner.
Okay.
Did we lose you, Bonita, for a second?
You did. I was gone.
You're back.
I'm back. I'm sorry.
No, you're fine.
Okay, let's move to the positive things about getting a mammogram.
Early detection.
Early detection.
Once you have the information, you can figure out what to do about it.
Earlier processing of the diagnosis.
A sense of relief.
Thank you. Peace of mind.
I think there's also a lot of programs that will help you pay for it. So, you know, it might be affordable.
Empowerment.
For a lot of women we talk to, it's what gets them into the door to a clinic for other things too. If you can get them in for a mammogram that's paid for.
Okay, let's move to the not so good things about it. About getting a mammogram.
And say the cost associated, even the deductibles, if it's paid for through some health insurances, can be high.
Okay.
A diagnosis of cancer.
Diagnosis of cancer.
Yeah, having one more negative thing to deal with.
Pain.
Okay.
Taking the time off of work and like making the time for it.
Okay. Okay, I'm going to stop this right now. Did I go? I lost your slide.
Oh, sorry, I took it down. Did you want to reference it again?
Well, I'll just go on to mine. That's
Okay. Sounds good. I think people came up with a pretty good list.
Yes, that's a good list.
Yeah.
And when we're talking to clients, we want them to come up with their own list. We don't, it doesn't help for us to give them the answers. This is a self-evaluation that we want them to do. And so I'm for, rather than working with that, I see if I can get my slides going again. I just kind of threw up a couple examples here. And when you're, after they've completed this, how you work with it is you ask them, so where does that leave you? After you've done this self-evaluation, what do you think you ought to do? And they will go back and forth. You can reflect the ambivalence that they have. So on the one hand, you don't like the procedure, and on the other hand, you need to know whether the lump that you feel is cancerous or not. So you reflect both sides if they're giving you, if they focus on one or the other solution. So you listen to them to see where they are and reflect their ambivalence. And remember to use the and. And as they explain it to you, their choices, you can kind of hear where they're leaning. And then after they've explained that, you just say, so where does that leave you? Are you still ambivalent? Are you leaning to one side or the other? That kind of thing. So it's important for us to not, this is the place where it's real easy to get into that expert trap of knowing what's best and to try to push them toward the positive of getting it. We want them to come to that decision themselves. If they get stuck with filling this out, you will know that they may just lack knowledge about what a mammogram's for. So you could ask them with permission, would you like to know some benefits? If they can't fill out that positive of a mammogram change, you can ask them if they'd like more information. So it's a way of getting to the place where you understand where they are in their decision making. Any questions about that? I'll take just a minute to see if there's any questions at this point. No questions? Okay. So the other thing we're going to be listening for as we do that is for change talk. And what we're listening is getting our ear tuned to hear that. And this is one of the things as they've evaluated the effectiveness of MI, listening and reflecting change talk seems to be the key of what separates motivational interviewing from other counseling styles. So this is kind of the heart of what we're doing. Most counseling styles have the other skills involved, but the change talk that we're listening for is their desire. I wish, I want, I like. So you're wanting to know if they have a desire to do something different. Their ability, I think I can do this, I could do it if I wanted to. Those kind of statements reflect ability. Reason, I'd be healthier if, I'd be a happier person if, I'd be more relaxed, less anxious if, those kind of things. The reason why the new behavior would be good. And their need. I have to, I got to, I just don't have a choice. You know, my family all has breast cancer and I just need to know what my status is. Those kind of things. So those first four, the darn, are the things that you're going to hear most often. The desire, ability, reason, and need. And if you can make yourself a cheat sheet to have on your desk, this is what I'm listening for, and really fine tune your ears to hear those things. And when you have a choice of what to reflect, you always reflect the change talk. So they can tell you a sob story, complications, 20 complications or whatever reasons why they don't. But if you hear an inkling of change talk, then that's what you reflect back to them. Then the CAT, the commitment, intention, decision, activation, readiness, prepared, and willing, and taking steps, that tells us how ready they are to make a change. And so you listen to any previous attempts at changing, what their intention is, what they're prepared to do, what they're willing to do, if they've taken any steps, like have they made an appointment before, have they arranged a ride and then backed off, any steps that they've been taking. So if of all the things that we talk about, this slide is probably your most useful slide of all of them. So we're going to have an exercise taking, I can't see my own slide here, plucking the change from the jaws of ambivalence. And this is on, and if a client reflects, I really don't want to stop smoking, but I know that I should. I've tried before and it's really hard. Would you reflect, you really don't want to quit? It's pretty clear that it's pretty clear to you that you ought to quit, or you're not sure if you can quit. Okay, can we poll their answers?
I would say number 3, you're not sure if you want to quit.
Okay, I think we're going to do a poll.
Yeah, do you see that, Bonita?
Yes, I do.
Okay, so go ahead, everyone. If you don't have the latest version of Zoom, you may not see it, but go ahead and choose your answer. We'll give people about another 10 to 15 seconds, and then we can show the results.
You choose it and then...
Yeah, so 12 of 20 of you have participated. Okay, 14, 15. There's a couple of you that haven't quite yet. Okay. Okay. Great. I'm going to go ahead and show what people chose. Okay, Bonita?
Okay, sounds good.
And I'm going to share results. Can you see it?
Okay. 29% said it's pretty clear that to you that you ought to quit. And 71 says You're not sure if you can quit. Okay. The 29% of you are reflecting the change talk. It's pretty clear that to you that they ought to quit. So you're reflecting their need to quit. They, in that statement, that I know that I need to quit. I know that I should. So you're reflecting back that they need that. When you're reflecting back, you're not sure. That's a sustained talk. They want to stay the same. I'm not sure I can. So the 29% of you got the change talk.
For the number 3 that you're not sure if you can quit, like, does that allow people to open up more about why they don't think they can? Like, could that be helpful, or is it better to just focus on, well, you think that you should quit?
Well, they reflected sustained talk and change talk. So if you want to reflect, you can reflect both with an and, or you can just reflect this change talk. Because what they hear themselves saying, when you reflect that back, they hear that change talk, and what you're doing is ignoring the sustained talk. They're pretty firmly planted where they are. They don't need help staying where they are. When you reflect the change talk, it builds their case in their own words. They've said it. You didn't say it. You're not pushing them. You're just reflecting the positive or the change. So if they found that it's most helpful to reflect the change talk. If you reflect the other, you need to do both. Does that make sense?
Yeah, it makes sense. It just seems kind of like a weird phrasing. Like, it's clear to you that you should quit. Almost sounds like you're telling them what to do, even though you're reflecting their own words.
Yeah, but I know I should. You could word it a little different, and I think in my so we'll look at that. You can use their words, so you know you should. You know, you need to. What I've tried to do to emphasize the desire, the 4 change talk types, I try to use those in my reflection. So you feel like you should do this, or you need to do this. Okay, that might be a little less than ought.
Thank you.
Okay. 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 Here's another. It's really important to you to stop smoking, and you have even tried before, is another way. Because in the statement, they said, I've tried before, and it's really hard. You're reflecting that they've tried, and it's important. They need to. So another way of reflecting that. So the first step is to identify what's the change talk in the statement. And then you can build the reflection on that change talk. If it's the first thing they tell you, you may want them to open up, but you want them to open up, tell me more about why you should. You want to explore the change. Okay?
Bonita, can I jump in real quick?
Yes.
Yeah, so I'm going to go through and give everyone a number similar to what we did last time. We listened, we heard you, and you liked doing this as a full group exercise versus in the breakout rooms. So I'm going to go through and just chat you a number 1 through 7, and this way we do still expect you to participate, but we'll do it similar to we did last time. Are there any questions about how? Bonita will go through the slide and then we'll ask for the participation.
Okay, these are, I need to get this out of my way. There. These are situations that were done in a survey, and we're trying to apply motivational interviewing. Most of what these examples are doing reflections. There's not a lot of change talk in these. It's going to be helpful if you can, and we'll have an exercise at the end of an assignment for you to work on the change talk. But these, if you find any change talk, let's highlight it. So, distrust in government, defined as doesn't sign up for federal and state health programs. And an example of a patient statement is, didn't sign up for Medicaid because I don't want the government to know anything about me personally. So, shall we start with the first group? Number ones, can you do a reflection back for that? What would you say after that? Either a reflection or an open-ended question. How would you respond to that? Who's our number ones?
You have Angela, Aurora, and Camarise.
I might be inclined to ask an open-ended question to kind of get more at the root of why they're not, like what they're not wanting to know maybe.
Okay, give us an open-ended question.
So I might say, or I guess reflected. So I understand that you're not wanting the government to know anything about you. What do you have any specific concerns maybe? But that's not an open-ended question. What specific concerns might you have?
Right, that's better. Good catch. Okay. Who's next?
I want the government to know anything about me. Oh.
Just give it a try.
Probably, I don't know. Let's see. Can you guys hear me?
I can't hear you very well. Talk a little louder.
Probably they're just in the process. I don't know. Let's say they're just, let me see. I don't know exactly how to ask the question, but probably they're just in the process of they're becoming legal, or not exactly. They're just applying for their citizenship, and that's why they don't want to share that information.
So what would you say to them?
So I will say that I understand like their privacy. Is there something else that I can help them with, and that I try to explain that information, like some information will be used, plus not all of it, because it's important for the health. Let me see. I don't know how to explain that.
So just,
Let me see.
I think you gave us the example. Is there anything else I could help you with?
Yeah.
Okay, that's a good try. It's important not to second guess why they're saying that. We have our ideas of why they might be saying that, but
Let me see.
let's go on to the third person.
Would it be
Yes.
a good idea to have the patient reflect on the pros and cons of
Myself.
giving the government that information.
So how would you do that?
I guess reflect first and say, I understand that you do not want to share your information with the government. But, well, I guess not the word, but, and do you feel like, what do you feel are the benefits of giving the government that information? I don't know.
Yeah. So you're trying a double-sided reflection, and you're saying the government, you don't want the government to know, and you need Medicaid.
Yes.
Okay, you just assume they need Medicaid because they didn't sign up, and they're giving you the reason they didn't sign up. You don't want the government to know, and you need Medicaid. So that's the double-sided reflection there. Okay?
Okay.
I would just say, tell me more. What is it that you don't want the government to know about you personally? And then just kind of leave it up to them to kind of say the reasons, and then maybe go from there.
Right. Probably just even saying, tell me more, and then they can decide what they tell you more about. If you say the reasons why, you're doing the sustained talk. So if you tell me more, they can decide whether it's, I really need Medicaid, you know, you want them to go with the sustain or with the change if they can, but just keeping it simple, tell me more, lets them take the lead in the beginning. Okay.
Yeah, I was just trying to do some reflection on the statement, just because they're saying I don't want the government to know anything about me personally. So then I would just want to know, tell me more. What is it that you don't want them to know? So I don't know. I guess I was just trying to reflect on the statement too.
Right. Right. Well, thank you for your tries. You're getting the idea. And this is just an example of an MI response. Your privacy is important to you, so you're acknowledging their privacy. And it is to us as well. Tell me more about what concerns you. So it's a way of affirming their concern. So in this example, what concept was this example demonstrating? Thank you, the oars. It's still group one. Group one still, what is this statement? It's Aurora. Who else is in that first group?
We have Angela and Camarise.
Okay. So Camarise, what, this response, what skill is it?
I don't know. I think I'm maybe a little confused. What do you mean by what response is it?
What skill is it? Is it a affirmation, a reflection?
Oh, for example, your privacy is important.
Open-ended question.
I guess it would be it's a reflection, and I think I would say affirmation as well.
Right. And the tell me, okay, next try, or next, Aurora, how about you?
Without it being an actual question, it's an open-ended question, essentially, with the tell me more.
Right. And who's the third one?
The open-ended question, because you want to know more why it's going on, or what is exactly concerning them.
Right. Good. So the tell me more is a question without it being a question. You're right. And the first part. And often you start with a reflection and end with an open-ended question. That just kind of keeps the flow going. So group 2, Erin, can you identify them?
Sure. I have it written down. Carolina, Selena, and is it Chacoma? Sorry if I'm saying your name wrong, but let us know the proper pronunciation when it's your turn.
Okay, this one is on culture, American Indian tradition medicine versus Western medicine. The example of the patient statement is, my beliefs and culture for healing does not fit in with the white and Western medicine approach for healing.
So I totally agree. Like, I think there's a lot of cultures that have healing practices that could be equal to, better than what we have. And so I think it's just understanding that, like, well, for example, a mammogram, like, that's not necessarily something that, like, is within your cultural practice. So we could do, like, the mammogram and get the medicine for that. But, like, if you're going home and also doing other things, like, that's also okay and totally appropriate.
Okay, so you're affirming their beliefs?
Yeah.
You're just agreeing with their beliefs.
I think I'm, like, giving them the opportunity to say, like, your beliefs are valid, because I think some people wouldn't, and then also saying that, like, but within, like, having cultural healing processes, you can add some elements of Western medicine that maybe aren't available, like the mammogram.
Okay, if you can identify who you are, it would be helpful.
This is Carolina.
Carolina, okay. And Selena, how would you respond?
I'll go ahead and unmute you.
Your beliefs are different from Western medicine, but is there anything that you're willing to do to make this change? To get the mammogram? I don't know.
Okay, that one's a little hard, isn't it? Okay.
Yeah.
The third person?
I would just ask again, just to tell me more. Maybe can you just give me a few examples of what are the differences between your beliefs and culture versus the Western medicine? What are some of the pros and cons, perhaps?
Okay, so getting more information. Okay, good tries. This is an example of a MI response. Your beliefs and culture are different from Western medicine, and you are a little cautious or curious about what, if anything, Western medicine might have to offer. And then the slashes are a pause. What do you need to know about your belief and practices? What do I need to know about your belief and practices? And a pause. And help me understand how our services might be useful for you. Okay, same group of 3. Can you identify an MI skill that is in that response?
You're trying to elicit more information.
Okay. With which statement or question?
I mean, all of them. Like, what do I need to know? Like, that's responding to the pushback and, like, asking for action despite that. Like,
Okay.
it's kind of like change talk almost, but not change talk because they didn't imply change.
Okay.
It's finding change.
Right. And that was Carolina?
Yeah.
We have Selena and Elena.
This is Selena. You're reflecting on what they said about their cultures and beliefs.
Okay, so a reflection.
I think just when it's just stating that help me understand how our services might be useful to you, you are, what is the word I'm looking for? You're validating their, their culture, which is okay, but you're also asking them with an open-ended question, how can our services be more useful to you?
Okay. So trying to draw out maybe even the change talk from them.
Yes.
Okay. How we're doing. We have 7 of these today, so we need to move through as quickly as we can. Group 3, healthcare is not a major priority, and the definition is food, lodging, and basic needs are more important than health tests. And the example of the patient's statement is, I don't believe in doctors. So some of these are really hard. What would your response to this client be? And who do I have in the room this time?
Elizabeth, Gloria, and Chacoma. I'm trying to chat her to see if she's able to get her microphone to work.
Okay.
So let's just start with Elizabeth and Gloria.
Okay. Elizabeth, you want to go first?
Sure. Gosh, this one's kind of hard. I guess I would just say, sorry, I'm thinking, I'm processing.
It's okay.
Definitely the tell me more, but I guess I would also say something like, can you tell me about some services or some circumstances that you would be open to seeing a doctor or something like that?
Okay. Gloria?
What I am hearing is that you don't believe in doctors. Can you tell me more about why you don't believe in doctors?
Okay. Do we have Chacoma?
I haven't heard back, so let's just
Okay. Okay. This one's a hard one. A simple reflection. You don't believe in doctors. Tell me more. Is just kind of staying neutral, going with following them. This is an example of a MI response, and it's a different, a little bit more than a simple reflection, but tell me what it is. Being responsible for your own health is important to you. Tell me more about your concerns. Pause. If it's okay with you, I would like to show you this information that may help you, may not be helpful to you as you, what? Or may not be helpful. It may or may not be helpful to you as you make your health choice. And then they give you permission. What do you think after you've given the information? So what skills are those? The middle one is the may not be helpful. Go ahead.
You're asking them permission to give them more information, for their permission, so you can give them the more information on
Great.
making healthy choices.
Okay. And who was that?
Gloria.
Gloria. Okay, Elizabeth?
I don't know. I think it's like very like understanding. Like you start with like what are your concerns, and then you end with like what do you think? Like this is very like up to you, optional. I'm here for you type of talk.
Okay. So affirmations. Right. The first reflection, being responsible for your health, is important to you. When they don't believe in doctors, you're assigning it new meaning, trying to get beyond the foot on the brake kind of thing, is and giving it a new twist. You're responsible for your own health then. You know, if you're not going to leave it up to the doctor. So it's changing it over and giving them room to move again.
So Bonita, is that an example of a complex reflection?
It would be, and it's got a guess in it of the true meaning of they don't believe in doctors. You're taking a guess. It's a reflection with a guess. I'm guessing at the meaning if I'm wrong, they will correct me. So sometimes you just have to take a guess of what they mean by that statement. And if you can give it a positive twist, that keeps it in a positive form rather than, why don't you believe in doctors? You know, that keeps it pretty negative. So don't be afraid to use your guessing muscle, because they will correct you if you're wrong, and you'll still find out more information. So the middle, tell me more, is open-ended without being a question. And if it is okay with you, that's asking permission. And in the middle of that, this information may or may not, I stumbled over that, this information may or may not be helpful to you, is keeping from pushing the information on them. I don't know if this will help you at all, but it may be helpful. And somebody that's so already on the brakes, you don't want to push them anymore, because they'll just step on those brakes harder. So you want to make sure you always have choice in the answer or in the information. And then, of course, asking for their feedback. What do you think after they get the information? And when you get that feedback, you'll see if you have any movement from, no way do I like doctors, I don't trust them. Okay?
And Victoria had a comment to add. She said one thing she might say, if you're here, if you don't believe in doctors, what brings you in here, and what might we help you with?
Okay, that's good. Well, what brings you here today then? Yeah, that's a good way to get it into a positive thing. Okay, group 4, how are we doing with time? I think we're doing okay.
Yeah, we're right at 10 now, so yeah, I think we're doing good.
Is it just 10? I have 10:20 on the clock I'm using. It may be wrong.
No,
it's just 10? So
yeah.
We can spend a little bit more time.
Yeah.
Okay, thanks.
Yeah, so we're on 4s, right?
Using the wrong clock. 4s, yes.
So Hillary, Julie, and Laura. Guys are up.
Okay, past experience with clinic or hospital. Definition is negative or racist experience with clinic or staff. The example of patient statement. They treated me like I was stupid and accused me of being drunk. I don't even drink. I cancel my appointment if I haven't been able to take a shower because they, the providers, think that Hispanics are dirty.
So in my role as a community health worker, I have come across a situation that's similar to this. And I offered to attend the appointment with the person to try to help, bridge that gap. And then I also helped try to find out why they hadn't been taking a shower on a regular basis, which opened up to more social determinants that needed assistance.
So tell me, what if the patient said that to you, what would you say to the patient?
I would probably say, I would probably confirm the way they felt. So I'm sorry that you felt like they were treating you stupid and accused you of being drunk. I know that sometimes engaging with these types of services can be difficult. Would you like some assistance? I can always go with you to attend your appointment to try to help you get your needs met, like something along those lines.
Okay. And your name was?
Hillary.
Hillary?
Mm-hmm.
Okay. Thanks, Hillary. Who's next?
This is Laura. I can go next.
Okay, thank you.
I would also apologize to the patient for the way that they were treated. I would, with their permission, ask if there was. Can you hear me?
Yeah, pretend like I'm your patient and just do it.
Tell me more about why you're not able to take a shower on a regular basis.
Okay.
And then, like the other person said, that would open up, hopefully, more discussion as to what their current living conditions are.
Okay. So you're after what the barriers are?
Yeah, I'm trying to elicit more information with regards to their barriers, right?
Okay. Who's our third person? Thank you, Laura. Who's next? Who's the third person, Erin?
Julie, I know you just unmuted here. Maybe we'll try again. No? Julie, can you speak up, or would you rather use the chat? I know you're unmuted, but we can't quite hear you yet. Well, maybe we move on. Julie, why don't you type your response in the chat if you can.
I kind of think it's important to really get down to why the person felt like they were treated like they were stupid and being drunk. I think it's important to understand what that looks like, because a lot of times patients just feel that way. It's nothing that the provider actually did. So I think kind of eliciting more information around that experience would be important.
So if I'm the client, what would you say to me?
Maybe, can you tell me a little bit about the experience you had last time that made you feel that way?
Okay. So joining with them a little bit and getting deeper into their experience.
I think I just want to know what that experience was like, because that's going to really shape what my next steps are with that person to see what kind of help they need to get them engaged.
Okay. Okay, the MI would be joining with them and helping them feel comfortable. Yeah.
Yes.
Okay, the same, and that was Julie? Was that Julie that was just talking?
No, that was Hillary, because
okay.
I didn't know where Julie was.
Okay, thanks. Okay. am I responsible? You have felt misunderstood in the past. I'm so glad that you had the courage to tell me a little about yourself. What am I concept is that?
Affirmation.
Okay, which part's an affirmation?
The last one.
Okay, I'm glad you had the courage to tell me a little about yourself. Okay. What else is it?
It's somewhat of a reflective statement.
Okay, you have felt misunderstood in the past. So it's not a simple reflection because I'm not reflecting back their words, but saying that they're misunderstood is the essence of what they were telling me. So you're, in a way, summarizing their feeling.
That would be my understanding.
Yeah. So,
because it gives them an opportunity to say, no, I didn't feel misunderstood. That's not what I'm trying to say.
Yeah. So if we look back at the person was feeling stupid and drunk, and they don't drink, they're saying that wasn't me at all. So that's where the misunderstanding probably was. So there's, as long as you're reflecting the information, it will keep the conversation going. And it's not like one answer is right and the other one's wrong. It's a reflection. You want to keep it moving and hopefully toward a positive direction and help take off some of the brakes. Because that person had a lot of brakes too. The resistance, they came in not wanting to be there. And they are trying to avoid any negative experience by canceling appointments. So the affirmation there of the courage is telling them that you realize that it took a lot of effort for them to get there. Thank you, Hillary and Laura and Julie.
Bonita, real quick before we move on, Carolina had a good thought she kind of wanted to throw out to the group about language. So she said, I'm always curious about using the word courage or brave because it can be empowering to someone and show understanding for their difficulties, but it can also make people feel as they're being patronized or pitied. Thoughts about that from the group?
Does anybody have a response to that? What you
Hillary says she kind of feels the same way, and just really needs to kind of feel out how the individual is before, if the word would be appropriate with them. Just get a feeling from the interaction.
Mm-hmm. It could be, depending on.
So if that was the case, well, I'm curious what everyone thinks, what other words might be better to use in this case, if someone was feeling patronized.
Maybe just like, I know it's hard to like share experiences like this, and like I appreciate that you like are sharing this with me.
Okay, just use the word hard, difficult, something like that.
Thanks.
So, any other comments?
Sienna said, I might say, I'm glad you felt comfortable to share this with me. Victoria said, I understand it took a lot for you to share that. I really appreciate you sharing that with me. Well, thanks, everyone.
And those are a lot of affirmations. Okay, we're on group 5.
All right, so we have Jennifer and Azza in group 5, and they're going to type in their chat because they're in a really noisy environment. So I'll just read out their responses if that works for you, Bonita.
Okay, thank you. Western medicine may not have the same connotations and practices for personal healing. Okay, so I'm the patient and I say, we never get the same treatment as whites. They don't give us real medication, only sugar pills.
Give them a second. Any thoughts, Jennifer? And in the Carolina's wondering, Bonita, where do some of these statements come from? Are they from your personal experience?
No, I didn't make these up. These statements were given to me as from the survey they did to get the barriers. And I asked them to give me sample statements of what the client would say that would indicate that that was a barrier. And these are the sample statements that they gave me to apply MI to. So I didn't make these up, no. I'm trying to respond to them just like you did. I think it was people that have worked with clients concerning these that made them up. Some of them may be things you hear, some of them may not be things that you hear.
So Jennifer and Azza said, oh, they put in the chat to everyone, but I will just read it out loud. So I understand you feel like your cultural values aren't being respected. Can you tell me a little more about why you feel you're getting different treatment?
Okay. That was both of their answers, or is there another one? Okay. So just exploring cultural values a little bit more. Right. So just exploring that a little bit more. Okay, so this is an example of a MI response, and look for what skills it demonstrates. Knowing that you're getting the best treatment available to you is important to you. What do you know about the different treatments? Menopause. We have information about the choices in treatment. You can review and come up with questions to ask before talking to your provider. Is there anything else that concerns you? So what are these skills?
They said reflective statement and open-ended questions.
Anything else?
We could open it up to the group too.
Yeah.
Julie, are you able to chime in?
Can you hear me?
Yay, now we can hear you. How's it going?
It's not going so hot for me today. I'm not very computer smart today. But good, I'm on the phone.
Perfect.
I'm
Well, we
having
can
trouble.
hear
I
you
can't
now.
see the screen now, but I think it'll come here in a minute. I am finding everything very exciting, and it is difficult when somebody point blank says that they don't like something or they don't believe in it, to kind of very slowly and compassionately try to acknowledge where they're coming from without making them be on the defense. Or everybody's comments have been very helpful. It is hard when you're put on the spot like that.
Yeah. So do you have any, can you identify any of these skills? Can you see the screen?
For some reason, I'm not seeing the screen right now, but I did, what's interesting is all of the skills, just depending on what the patient's responses are, it seems that for motivational interviewing, that oftentimes the best skill we can have is listening and then reflecting or affirming, as you guys were speaking about. Mm-hmm. And yes, just asking open-ended questions where they can't answer yes or no types of things, so that I'm guessing they're a little bit shy, but not sure if they really trust us or not, is what it kind of seems like. So if we can gain that trust over some of these skills by listening, reflecting, or asking questions, it seems like it would help us.
Right. And I think in this one, knowing that you are getting the best treatment available is important to you. I think if you go back to the statement, we never get the same treatment, it's empowering of them. It's a reflection of what they said, but it's also an empowering thing that you're in charge of knowing what the best treatment is. And so it's helping them understand that they can ask for the best.
And I agree with that. I was thinking of the young lady that said at the very beginning about how sometimes we just start giving out information because we do know a lot of things and we kind of overwhelm our patients. And we just sometimes, I think, need to go slower.
Right.
So I have a question, Bonita, about the, so we have information about the choices in treatment you can review and come up with questions to ask before talking to your provider. So that's sort of a combination, right, of permission to give more information right there, but you're also sort of, like you said, empowering her at the same time by asking if it's okay, kind of going on that we can go further and review. I get a little confused with elicit at the end. Are you also saying is there anything else that concerns you, combining that with permission right there? And is there something else too?
And it's kind of a shot in the dark because you don't know what their response was. Every time there's a slash, you would of course go with a response. Anything else is just not assuming they're finished telling you. A lot of times if you're in a session, it's that hand on the doorknob, last question before they walk out the door. And it's a way of making sure that they're finished with their expressions or their ideas or questions. It's really not, what do you think of this information? That you probably would have done that first and then say anything else. So
thank you.
Bonita, this is Hillary. I think MI allows us the ability to really dig down with our patients that we're serving about how much information they do know about what's going on. And I know I come across this a lot with my patients being Google doctors. And so they will come up with all this crazy information and I will have to go, okay, now that you've told me everything you know, let's really dig down as to what your diagnoses is, or what your specific treatment plan is that the doctor would like you to follow, because a lot of times there's so much information on these WebMDs and Google things, and you can almost like get paralyzed from having too much information. And this allows me to say, time out, that's because this person had this going on too, or it allows me to really personalize it by allowing them the ability to talk to me about what they know.
Right. And if they're missing any information, or if they've included information that doesn't necessarily pertain to them, you kind of know where your starting point is. And the internet certainly has changed the whole medical environment, because most people have their own diagnosis before they even come in for a diagnosis, just by analyzing their own symptoms. And it's good two ways, because you want to make sure you're getting the best treatment. Like this client wanted to know, they didn't think they were getting treated the same way. And so it's an empowering way of, so the clients have done a lot of research. So even if they over-research, you can tell them you're really interested in being in charge of your own health. And that's a good thing. That's been a big cultural shift. It used to be, for my parents, you did what the doctor said. You didn't question it. You just did it. And today's society is, everybody's so mobile, and they may not see the same doctor twice. And so you do have to be in charge of your own health. And we need to, as healthcare providers, we need to acknowledge that the client really is in charge of their own health. And if they research something and they have more questions about whether it applies to them, we need to acknowledge that and empower them to ask questions and help us navigate it for them, because they're the ones that have to make it work. Any other comments? Let me see, what group are we on now? 6?
Yep, 6. So we have Lisa and Michelle.
Lisa and Michelle? Okay, this is suspicion. Doubt that providers give the individual the same level of care as white people. We're seeing this as a theme through here, a lot of discrimination. So the patient's statement, and just pretend I'm the patient. White people get colonoscopies, and we get FOBTs. So how would you respond to that?
What can you tell me? Let's see. I would ask them, what can you tell me about the difference in a colonoscopy and FOBT? Because I want to understand that, why you think one is better than the other.
Okay. Who was that?
That was Michelle.
Michelle. Okay, Lisa?
This is Lisa. What's a FOBT?
Is that what you would ask them?
No, I'm asking first, what's a FOBT?
I believe that's the blood test.
Yes, people call blood testing. It's still a test for colon cancer screening.
Okay.
So
yeah, again, this is Lisa. I would ask, what do you know about a colonoscopy and a FOBT, and see what type of answer I get and go from there.
Great.
This is Michelle again. I thought about this, and I think I would answer with, it sounds like you think that your ethnic background has helps in the decision about what care you get.
Okay.
And can you tell me what leads you to think that, or tell me about a situation where you find this to be true?
So you're trying to affirm their
right, their feeling.
Their feeling.
Okay. Mm-hmm.
Anybody else? Okay, this is an example. You are concerned about how decisions are made and want to make sure you get the best test for you.
Mm-hmm.
Tell me what you know about the differences in these tests. So this information might help you understand what care you can expect. And then what are your thoughts? So identify those skills for me.
Okay. Open question.
Okay.
This is Michelle. Oh, I'm sorry.
That's okay. Go ahead.
So you are concerned about decisions is an affirmation, and tell me what you know about the differences is an open-ended question. And then this information might help us understand what you expect. To me, that's a little bit of a summary.
Okay. Okay, and Lisa, was that you that answered the
Yeah,
question?
that was me earlier. I'm sorry. Mine was an open question, and it was tell me what you know about the difference in these tests.
Okay. This information might help understand the care you can expect. It's sort of a question or asking of permission.
Mm-hmm.
You could follow it. Would it be okay if we go over that? You could add that question in there, but it's sort of a question without a question or asking for permission.
Mm-hmm. Correct. Mm-hmm.
And then what are your thoughts? That's the follow-up of after sharing the information.
Mm-hmm. Yeah, that's an open-ended question. I thought that this information might help understand what you can expect. I was kind of summarizing why I was asking those other questions, and then the what are your thoughts was an open-ended question.
Right. That's good. All right. Thank you, Lisa and Michelle.
Thank you.
Now, group 7. Who do we have in group 7?
We have Wendy, Sienna, and Victoria. And if there's anyone, I think I got everyone, but if you didn't get to participate yet, you can participate in this round.
Right. And this one, I have a couple different examples of response. Too much to take care of now, can't possibly think of what may happen down the road. The definition is poverty was rampant, uncertain of the next paycheck. Okay, the statement that made us think that was a barrier is I can't even hardly put food on the table. What would you respond to that?
Oh, this is Victoria. I think I would start off with letting them know, empathize with them and then asking them what we might be able to help them with, what they might, what are your barriers? What might we be able to help you with? We have certain programs, go on to let them know, have they talked to so-and-so, or would you mind if I called so-and-so and see what we might be able to help you with?
Okay.
This is Sienna. So I would affirm their struggle, saying, I'm sorry that you've been struggling to provide food for your family or for yourself. Can you tell me about some of the programs you're aware of that could help in this situation? So elicit, provide, and then elicit. That was kind of the thing I had focused on, was instead of just jumping in and trying to fix the problem and give them all these options, just kind of asking what they know of already and if they want more information on some different resources that could help.
Okay.
Hi, this is Wendy. Yes, I would reflect right away. I hear that it's there are a lot of real difficult, I wouldn't use the word barriers. I would hear there are a lot of really difficult things right now you're dealing with. Most importantly, making sure that you can eat. And so before I would reflect and you're concerned of what may happen down the road, I would fit that in. But yeah, up front, I would definitely talk about food and any other, maybe find out what the concerns are.
Okay. So using a lot of reflection and provide elicit. That's good. So there's a couple of examples of responses, and identify the concept that the example demonstrates. You are working hard to provide for the immediate needs, and you have taken the time today to consider your own health. How could we help you today? What's that?
Reflection. And
affirmation.
Okay. Followed by an open-ended question, right?
Yep, open-ended question at the end.
Okay, you guys get double duty because here's a different response. Eating is certainly important. Tell me what else is important for you to do. And then it's a pause and letting them answer. Then there are some things that you can do to make sure that illness doesn't sneak up on you. With your permission, can we review the ones recommended for you today? And then what are your thoughts? This is a response of, that say a doctor said, help them understand this. They hand it off to you to follow up on. What skills are here?
Well, there's reflection. What's eating is certainly important to you. And open-ended, tell me what else. I don't know if I should answer it all that other people too, or do you want me to just go through it?
You can
go through it. Okay. There are some things you can do to make sure that illness doesn't sneak up on you. So you're sort of asking, with your permission, you're giving some information further, and then asking with your permission, we can go over them. So it's like open reflection, and then trying to elicit a response with permission, an open-ended question. What are your thoughts?
Okay. So it's that elicit, provide, elicit again. All right. Okay. Let me see. How are we doing on time?
We're good. It is 10:36. And I just wanted to share one comment just to wrap up this. Victoria said she believes that the responses contain all affirmations, reflections, and open-ended questions. So,
okay.
Yeah. Thank you for your thoughts, Victoria.
It sounds like everyone is understanding those three, the basic ors. But I thought if we had extra time, we would spend a little bit more time on the darn cat, the change talk recognition. And so, let me see, we have about 10 minutes, 15 minutes, let's say. So if each of you could come up with, think about something that you're considering changing and come up with a change talk statement, a statement that has change talk in it. And how could we do this? Let me see. It's different than in a classroom on the internet.
Like we could get volunteers. I don't think we have time to go through everyone again.
Right.
But
let me change this a little bit. I'll give that as homework. Your homework, think of something that you might change and write 4 change talk statements to express desirability, reason, and need, and bring them with you next week. That'll be your homework. For today, I have a list. Maybe I can just read a statement and you can tell me what the change talk is out of that statement. And if we could we'll just do 3 or 4 of those. Does that sound okay? And whoever wants to respond can respond. The first statement is, I don't drink any more than most people I know. Sure, I sometimes feel a little foggy the next day, but it wears off quick. It's no big deal. Do you hear any change talk in there?
I hear it's a little foggy, so it kind of almost shows that they're wanting to make a change, but they're not really sure if it's a problem yet.
Okay, what would that be? Desirability, reason, or need?
Desire?
Could be desire. Or
a reason to change.
Or a reason to change. Good job. And the next one is, I was worried there at first, but I don't think I really have diabetes. The doctor said it is borderline or something like that, and I feel fine. Any change talk in there?
Can you repeat that again, please?
I was worried there at first. I was worried there at first, but I don't really think I have diabetes.
I was worried at first.
Victoria says that the worry might be part of the change talk, expressing that they have that emotion.
Right. Would it be desire, ability, reason, or need?
Ability to worry about it.
Or is it reason? Because they thought they were worried at first. There was a reason to worry, but they don't think so now.
It could be reason.
I would say need as well.
Yeah.
If they're worried, then there's probably a need to change.
Okay. That's good. Then this one, well, sure, I'd like to be healthy as I can, But I'm 68 after all. I figure I can get away with some bad habits. They won't have time to catch up with me. Any change talk in there?
The very first part of the sentence.
Okay.
I'm 68 and I'd like to be as healthy, I think, as I can.
Which change talk is that?
Desire.
Yeah, desire.
Okay. Try this one. It's such a hassle to take those pills. I'm supposed to remember to take them 4 times a day, and half the time I don't even have them with me. I guess there is a good reason for it, but it's just not possible for me. Any change talk in there?
I guess there's a good reason for it.
Okay. So that's they give you the word there, don't they? Okay. Try another one. I have no time to go to therapy. I really hate that I'm so much more impatient with my kids than I used to be. I'm miserable. That I can't leave them alone and I don't trust anyone else to take care of them the way I do. Any change talk in there? Need? Which part is the need? You got it.
And or just the part, please.
Yeah. The part that says I'm so much more impatient with my kids. That's expressing need, right?
Right.
Okay. Let's try one more. I used to exercise every day, and I have to admit, I felt better when I did, but it got to be too hard to find time, and other things were just more important to deal with. I really do miss it, though.
There's
have
two
the desire,
changes.
but I really do miss it.
To me, that's a change. I really do miss it, and a change is I felt better when I exercised.
Okay, so I felt better would be the which of the darn?
Maybe almost an affirmation, because you're saying you're affirming that you felt better when you exercised.
Action talk.
It could be a reason why they want to change, right?
Yes.
It could be they took previous steps. They had some action in there, previous steps. And I really do miss it. Somebody said desire. I heard somebody identify that as desire. So that last one has a lot of change talk in it. So this next week, between now and next session, if you could pay attention and identify as much change talk as you can, get your families to practice with you, practice with each other, listen to your clients, listen to your coworkers, listen to your family, your kids, everybody, and see if you can identify change talk and reflect that back to them. That's your homework assignment. Next time, we're going to be evoking and strengthening change talk. So the evoking is, how do you get people to say things to you? And then we're going to respond to change talk with ears. And then we're going to move on to planning. So if you can come with your 4 change talk statements, one that expresses desire, ability, reason, and one for need, and bring them with you next week, we'll have time to practice in an exercise with those. And it's important that everybody has one. So, and if you don't have them, you're probably going to have to do more of the work of being the client or the counselor. But that's what we'll be doing next week.
And I'll send that out in the email when I send out the slides. So you'll have this in the slides, but I'll also put in the body of the email so you can just reference it right off the bat.
Okay. Any other questions or comments about the MI techniques so far? We have, what?
Yeah, we have like 10 minutes. I know Carolina had a thought that we didn't get to. I don't know if you wanted to pose that to the group about bringing up like the consequences or expenses related to not getting health care. Did you want to talk about that at all?
You're asking me?
Carolina.
Carolina.
Oh, okay. No, I think just like some of the conversations we had were really like good at eliciting more information. But I think also something that's a significant impact for a lot of the people we work with is like, okay, if you don't get health care, like what is that going to mean? Like, and most likely the things that you're worried about are going to be exacerbated, whether that's finances or whatever. And so like kind of that like sort of real truth, like facing conversation, like where does that play into the other conversations that we're having with them?
Right. The healthcare, the cost, sometimes our clients have to make hard choices because if they don't have the money, they don't have the money. And if there aren't resources, there aren't resources. And sometimes it's really hard to know that they're going to suffer physical consequences of maybe being sick, those kind of things. I'm from a prevention background. I always like to, what do you know that you can do? You know, if it's a lot of things that they can't do because if they have boundaries of finances or no resources, what do you know that you can do? And, you know, like if they can't get in for a mammogram, they can't afford it. What do they know about self-breast examinations? Those kind of things. What do they know that they can do? What do they know about diet and exercise as far as prevention? What do they know that can leave them with an action step that they can do so we don't end in despair? I think they were going to post a lot of there's a place where you can go to know all the signs and symptoms of the different cancers. And so just being aware of those things can empower them. I think as healthcare workers too, we can be discouraged because we like to be able to have something to offer them, to do for them. And in reality, it's only the things that they can do for themselves. And we can't fix everybody, and we can't make them be good either. So the financial stuff is always hard because it's such a reality. Sometimes the MI, when people are listened to and somebody understands their dilemma, even though you haven't fixed anything, they just feel understood, and it's a relief that somebody understands. It's a valuable commodity. To have somebody that really listens to you, it's I can't overemphasize the importance of that. As far as their wellness, if you can just decrease their stress, their anxiety, you've decreased you've increased their immune system by listening and helping them feel understood. You're doing so much just by listening. Most people have to pay really big bucks to get somebody to listen to them. So it's important work that you're doing, even if you don't give them any resources or fix anything or do anything different. You're to be listened to be heard. It's a great gift. Did I even address your question or your comment?
Yeah.
Any other comments or questions?
I typed it in the box onto the side, but I think that using MI gives us a real power to focus on the person sitting in front of us. And I've noticed that through my work of doing this, that when I do that with people, it really helps them to understand that they have responsibility in their healthcare too. That it's not just the doctor that's going to give them some kind of magic pill, and if they don't follow up with recommendations, that there are consequences. So through MI, I believe that it really allows us to explore those responsibilities and kind of what their part of it is. So like, I hear that you want to, do better with your diet. However, when you go shopping out at the store and you only buy carbohydrates, that's a stumbling block and a barrier to you being on a good compliant diabetic diet, so it allows us that option to be able to kind of reflect what we're trying to give the message from our provider to the person and hope that they can really grab a hold of it.
Right, and that's where the power of and comes in. And you're shopping. You want to do this and you're shopping and buying carbohydrates to bring home to eat. It's keeping that the light will come on. Yeah, I kind of shoot myself in the foot or something, kind of thing. But when you reflect it back and they hear what they're saying and what they're doing, it's just really powerful. And the role of the navigators is to help people be self-empowered, because the doctors can't do it for them anymore. It used to be the doctors had all the responsibility, but that's not true anymore. So
there's just one comment I want to share from Michelle. This is where collaboration is very important. We need to know about resources in our community, and finding resources from other organizations could help.
Right. And I would just add resources online. They're using the computers anyway. Resources online that are good resources and those that aren't so good. If there's a good one. And even when we were preparing this, there are so many cancers out there, and to know a good resource of what are the highest risks for different people groups. And culturally, there are differences as far as the risk levels. So knowing that information yourself and having a resource that they can go to. I think Linda and Andy were putting together something that you could resource online, so you have that information, so you have good information to give your clients. If they're not much at risk, then it may not be as important than somebody that has real high risks. So understanding those yourself, understanding the prevention stuff, and knowing the resources of what those prevention things are. It would be a good handout to have. I don't know what you have as far as handouts go, as far as prevention. I know in our family we have such a high incidence of cancer. I had a sister that was hyper vigilant at it, and she was looking online for all these things, and her doctor says you'd be better off if you'd just go take a walk rather than spending the time in front of the computer, because we know exercise is a good prevention for most of the cancers. It increases our immune system and decreases our stress, which puts us high risk. If we're stressed out, we're real high risk. So just having a good resource for people to go to for knowledge, for payment sources, for transportation.
I think just sharing that knowledge in your communities in general is good. I know for our community down here in Cortez and Montezuma, we have a lot of different coalitions that we share information with one another on. And once a month I go and I meet with these people, and we always share resources. So I think just as care coordinators and people that help people with this kind of stuff, finding out what your own communities do in terms of trying to network and getting engaged in that is huge. I know for this area, if I didn't have the connections that I had, because everything that we have as far as specialty care is pretty much out of the area, that I would not be able to get many places with my patients without my support group and my community partners.
Right. Well said. Right. And that networking communication is so helpful to everyone. So if you find a new resource, share it with the world. Share it with your coworkers and even other areas if you find pay sources that other areas may not know about. And on the note of cultural awareness, and there's, even if you think you know a culture, you don't know, because there's overarching culture, but there's also family culture. So you never can assume that you know it all. And so you have to find out from the individual client, from your coworkers, what their cultures are, and to be self-aware of what your own culture is, so you don't impose your own culture on somebody else. That's a big task too. But hopefully, using your MI techniques, you'll be communicating well and listening, and we learn a lot when we're listening. So thank you for your time today, and we'll see you next week.